Hi, so I'm Gemma Hewitt, one of the nurse specialists from Norfolk and Norwich. We are one of the regional skin cancer department units in East Anglia. And my disclosures. So melanoma skin cancer survival in the UK has doubled in the last 40 years. Basically, you've caused us a bit of work. Basically, we're now surviving melanoma and need to think about how you guys are all feeling once you get to the end of your treatment and you're left to it. So this is referred to as the form of survivorship, which survivorship gets a bit muddled in the water in terms of what does it actually mean. I was just wondering if anyone wants to be brave and raise the hands of what they actually think survivorship actually means in terms of cancer. Be brave. There's no right or wrong answer, I promise. Anyone? Go for it.
Finding a way to live, as ridiculous as that sounds.
No, it's not ridiculous. It's bang on. Perfect. Talk done. That's perfect. Anyone else want to add? I saw somebody else. Yeah. Perfect. So everybody actually in the room is surviving, or a survivor, and in survivorship. So survivorship actually means having no signs of cancer or living with cancer or through and beyond. So that's everybody in this room is in the form of survivorship. But we can break survivorship down into 3 areas. And the toughest one is the acute survivorship stage, and this is when it all begins, when the cloud begins to come over you. So the start of the diagnosis and that moment when the practitioner, doctor or the nurse actually tells you you have cancer. And I'm sure everybody in this room can close their eyes and visualise that conversation they had the moment they got told that you've got melanoma and how you felt at that time, who you thought of first, what were your feelings, how you felt about the future and the uncertainty that we've talked about a lot today. That will never leave you, and there's no talk in any practitioner specialist's mouth that can actually make that moment feel any better. It will always, always be with you. The freedom, the innocence of the life has now changed. You're no longer you are somebody with a disease that you don't know what's going to happen. And the ability to make independent decisions has now changed. You have a diary full of hospital appointments that you're obliged to attend, and you can't just say, yes, I'll go for a meal tonight. I have to check my diary to make sure I haven't got treatment the next day. Once we've endured treatment and we go into the extended survivorship stage, this is when we can break it down into certain levels of what survivorship actually means. So we have the physical impact, how cancer actually made you feel, the melanoma, the scar, the surgery, the treatment, the side effects, which we'll come back to. The impact on your mental health, your ability to switch off. You've now developed anxiety, maybe depression, maybe post-traumatic stress disorder, all things that happens to somebody else and not you. You've developed emotions that you didn't even know you had. You cry at absolutely everything, even Emmerdale. You have difficulty in socialising. Friendships change. You have friends that you never knew you had before. You have friends that want to be friends with you now because you're that person with cancer and they feel that they need to be extra nice to you. And the impact of finances as well. I'm sure all of you can add up how much Costa coffees cost in a hospital, car parks, when clinics overrun, missing the bus, having to get a taxi home, all fees that mount up when you're having treatment, loss of earnings and employment. So that's the extended survivorship. Permanent survivorship is when we get to the end of treatment and we start to pause and look back and whereabouts we are now in our life. It's about the time to reflect. Who on earth was that person? How on earth did I manage to get there? And who am I now? But also the time when you look and think, actually, that was worse than I actually thought it was at the time. And you could have new emotions and feelings that you've not had before or even given a thought to. It's the fear of progression as well, reoccurrence, and what your quality of life is now. It's hard once you've had the treatment and you then get to the end of treatment and start feeling a little bit better, but you can endure long-term effects. Now, those that have had treatment for stage 3 and 4 melanoma with immunotherapy will know what a late effect is from the treatment, and these can be life-changing. Can I have a raise of hands if anyone in this room's had a late effect, a side effect that they've not been able to shift? It's pretty much everyone, and they're not to be laughed at all. So a late effect is a side effect related to the cancer diagnosis or the treatment, and then it can cure months or up to years or forever. And I think we actually are a bit slack in telling you guys that they can last forever, and that's really tough. So a list of late effects of treatment. I've broke them down into physical, emotional and social. There's a whole topic on late effects, and I could do pages and pages and pages, and forgive me if your late effect or side effect's not made the page. These are the most sort of common ones that I see in the clinic, and that patients come forward talking about and that we have to manage. None of them are to be dismissed. They're all as bad as each other. There's no winner for the worst case side effect or late effect. They all affect you differently. I've used examples from patients that I have looked after in my late effect clinic at the Norfolk and Norwich, and they are a little bit hard hitting. If anyone wants to add anything to how they felt or this has triggered anything similar to what they've experienced, then please share it with us if you feel that you can. But one particular lady, she was in her mid-40s. She'd finished her year's worth of adjuvant nivolumab. She was feeling a lot better. She was returning to work, but she had chronic fatigue. And it was something she really struggled to explain to her friends and her family, why she still feels tired. Because to them, she should be fine. She's finished her treatment. She looks well. She doesn't look like a cancer patient. Why she's still yawning, why she's still turning down dates to come out, what's wrong with her? So this is what she said to me. It's bad enough to have cancer, but to have all these symptoms of treatment that has saved my life, it's a constant reminder of what I've been through and I'm forever tired. Can anyone sort of relate to how she was particularly feeling? Another example was, I was told by my doctor to live life to the full, but I don't know what that actually means. I still have to hoover my house, go food shopping, and put my bin out. Is that living life to the full? I was quite naive, actually, when I went into oncology for lots of reasons, and one of the things I thought was actually living life to the full was going to the Maldives weekly, having a cleaner, a butler, someone to do your ironing, and actually it's the most simple things, like putting your bin out. I think this is a big one. I have a constant fear that it's not really gone. And we talked about scan anxiety, the big gaps when we leave you lingering and waiting for the next call, and that feeling doesn't unfortunately go away, but we hope in time it would feel a little bit better. And bringing us to this conversation of scans. Scans are like revolving doors, emotional roulette wheels that spin us around for a few days and then they spit us out the other side. Land on red, we're in for another trip to Cancerland. Land on black, we've made a few more months of freedom. I think that sums up the scan anxiety pretty well, and that was from one of my patients as well who likes to blog. Mr. Blogger. I've touched upon that I provide a late effect clinic where I literally sit and listen, and it's my favourite clinic of the month. I absolutely love it. I feel like I'm a member of Loose Women. It's brilliant. I just sit there and listen, and we put the worlds to right, and we start from diagnosis to how we feel today. And it's gone so well. It now needs to be a research study where we collect the data and actually produce some stats and figures, because we like doing that in oncology, of what the main things that people are struggling with after having treatment. And a part of that is screening for post-traumatic stress. Now, this lady, this lady was 54. She had Ipi-Nivo, which is a tough treatment to endure. She then came to the clinic. She was really good at opening up and explaining how she feels. But the question was, she felt she had done something wrong, because she said, Gemma, I have done all the relaxation classes, I've been to the Big C Centre, I've told my employer I don't want to work anymore. A bit extravagant, but she did. But I still got PTSD. What have I done wrong? Well, actually, she had PTSD already. What we'd found out is we screened her, we'd found out that that was the issue, and then she was on the correct treatment and extra support to do that. And the clinic helped her highlight that. She had done nothing wrong at all. A DS-1500 form, some of you may have heard of. It's a form that us practitioners, doctors can fill in to help get payment and PIP allowance, a government payment. It's a form where you would have it filled in if you were anticipated to have 6 months or less survival. And then this chap rang me up and said, Gemma, it's 9 months since you filled that form in and I'm still alive. Is that all right? It's fine. You don't give the money back, and well done. It's fine. You carry on. So then we get to the new normal phase. So what's your new normal? How are you going to be now? So you've had to change ways that you eat. There's certain foods you can't eat anymore. You've gone off alcohol. You may have taste changes have changed. Your level of support has changed. There's certain friends that have disappeared. There's certain friends that have come on the scene that you've met since having your diagnosis. You've got permanent scars to remind yourself of where your cancer was. You're constantly checking your skin in the shower. You drive yourself crazy with every freckle that arrives. You're constantly feeling your lymph nodes and now don't even know if it was a lump or a bump to begin with. You've got new routines that you've not had before. You know the phlebotomist by her first name. You have emotional scars from what you've been through and are still going through. And you'll see yourself so differently. And other people see you differently. You have a fear of anxiety. With anxiety, scans you dread, and you have the fear of reoccurrence or progression every single day. This is a Greek myth, the sword of Damocles, and he hung a sword above his workers' servant's head by a horse hair, and they lived in fear that one day that the sword would fall, and it would be them that would have the sword fall on them, basically. And we can put this into concept of how the fear of reoccurrence hangs over you. So it's time to move forward, and how I hope I would have felt like that. I would hope that I'd felt time to rejoice, and I'd hope that I'd be able to put the experience behind me. I returned to my previous life, but it wasn't what I thought. I thought I'd have a fresh start at doing something new. And I thought I'd be grateful for the reduced hospital visits. And I thought I'd feel brilliant because nobody would ask how my bowel function is anymore. Sorry, we love asking about bowel functions. Love it. So this was one of our patients, and she was absolutely fantastic in the clinic. She was sort of my guinea pig when we first started the clinic. And these are the things that she wrote down. I said, right, 5 things that you don't think that I know about cancer, go for it. So she said, it will be hard to go back to normal. I thought, yeah, I can get that one. Some people will not like seeing pictures of you. I'll come back to this. There'll be a new sense of fear in every part of my life. There'll be some awkward conversations to have. Hers were around fertility with her new partner. People will be scared to ask you questions, even though they've got stacks of questions to ask. And what she meant about the photos was that I'm not sure why people feel it's appropriate to tell me that they don't like seeing pictures of me when I was poorly and frail and overweight from my steroids. I personally think I look great because I've done something incredible. They often tell me that pictures of me during treatment made them sad, which is strange because they don't make me sad. I'm the one who went through it. And so as far as the survivor is concerned, if I can take the experience itself as well as the photographic proof, so can you. Be proud of it, be in awe of it, and see this as a short triumph, not tragedy. It's the single hardest, most rewarding thing I've ever done and feel empowered by me. So it's time to help. I would love to be able to tell you the magic answer to make you feel more in control of your emotions and help you feel less worried about the future, but I can't. I can only go by what patients have opened up to me and said, what things I've picked up on along the years of working in oncology, and we're forever, ever learning. The main things that have been said to us is discuss your concerns, keep talking. Know it's common to be afraid, and keep notes about your symptoms, not about your bowel habits, please. Manage your stress, you can do it. Talk to your counsellor, therapist, nurse, milkman, whoever you find comfort in talking to. Meditate, funky, I have to say that, we all meditate now apparently. Seek comfort from spirituality, find ways to help relax. Exercise, take part in clubs, classes, gatherings, anything that's going to make you smile. Make sure you have a follow-up care plan with your cancer team, you're not forgotten. Stay in touch with them, get enough sleep, go to all your follow-up appointments and don't be a rebel. Be kind to yourself. It's time to reset, develop new strategies to manage your emotional challenges, deepen relationships. You may have found that friendships have sort of fallen behind the waistline whilst you've been going through your treatment and what you've been going through. It's okay to revisit. You don't have to apologise that you've not been on the scene for a few years. Give them a text. It's been difficult. I'm here. Would you fancy a coffee? They're waiting to hear from you. Now's your time. Reevaluate your priorities and appreciate life more fully, which I'm sure you do. And adopt more healthy behaviours. And remember, cancer does not define you, you define it. Thank you.